HIV or the Human Immunodeficiency Virus, that is what is the expanded form of HIV, is a viral illness which is an RNA virus, which was recognized in the year around 1985, 86, where a few people who were basically male homosexuals who were being seen with this particular disease, which was causing severe infection, some kind of even skin cancers and other illnesses, and was causing them to suddenly, start deteriorating in their health and even pass away. Upon examination of those people, it was recognized that they were infected with this new virus called the Human Immunodeficiency Virus, because that's what it does. It attacks our immune system, the immune cells themselves. We have the B cells. The HIV specifically attacks a particular set of T cells and causes that to the number of the T cells to come down significantly. That is how we lose our ability to protect ourselves from other infections. So after somebody is attacked with HIV or infected with HIV, it takes a little bit of time for them to start feeling the effects of it, because it takes a bit of time for the immune cells to be slowly killed off and the number to be brought down to a sufficient number, sufficiently low enough to be able to allow for the attacks of other infectious agents to become significant. The HIV, the virus itself, rarely directly really harms the patient. It does to an extent, and we'll talk about it if we need to. But it's the opportunistic infections that it is exposing the body to and allowing for the infections to settle, to come in and settle into the body and cause a lot of destruction that then causes the ill health as well as eventual demise of the patient. Eventually, they develop what we call AIDS, and then they tend to not do very well, and it can be fatal. There are various modes of infection. Sexual contact is one of the primary modes of infection. Injection drug abuse, where there is needle sharing, is the second common mode of infection. In this, blood and blood product transfusion used to be one more mode of transmission, but now with all the regulations across the world regarding the blood and blood products, that is not a typical mode of transmission. Primary modes of transmission remain sexual contact, both heterosexual and homosexual, as well as injection drug abuse, where there is needle sharing. The third and very important mode of transmission is during childbirth from the mother to the infant. So these are the three major modes of transmission of HIV at this point. In the sexual contact, there are certain areas, like for instance, in India as a country, the heterosexual mode of transmission seems to be more predominant. In other parts of the world, the homosexual mode of transmission seems to be more predominant. And in other parts of the world, the IV drug abuse seems to be the most common method of spreading HIV. As I mentioned, once the person is infected with HIV, it can be a long time before they even show any signs or symptoms. In a few people, around maybe 20 to 30% of people, within between the duration of 3 weeks to 3 months, they show what may look like like an allergic reaction or an acute febrile illness, like a little bit of fever with some lymph nodes which may be enlarged in the neck, in the axilla, inguinal area, along with some rashes which may develop all over the body. So rash with lymph node enlargement with fever can come in the early stages of what we call an acute infection, where the person has contracted the illness just there, previous 3 weeks to 3 months. That is, but only seen in about 30% of people, not in a large majority. The large majority generally have no outward or even measurable signs or symptoms, other than the fact that they may have the HIV infection itself, which, when checked for, it would be positive. So they may not have any outward signs or symptoms all the way until they actually develop such opportunistic infections because of the immune cells becoming very low. There are two named types of HIV, HIV 1 and 2. And HIV 2 is found in some parts of Africa. In India, also, we find it in some parts of Goa and northern Maharashtra, etc., southern Maharashtra, etc. But largely, the HIV 1 is the more predominant strain of HIV that affects the majority of the sufferers. HIV is primarily diagnosed through some blood tests. So, the usual initial blood test is what we call the ELISA. This ELISA blood test is a serological test. The blood sample is drawn and the test is done, given for this ELISA testing. And either there is a positive or a negative based on the titer of the laboratory value. Now, once that is positive, usually we have to do a confirmatory test. Sometimes we repeat an ELISA, or we have some other tests which we also perform. Once we understand that the person has a positive test, we then go on to understanding what is the viral load, what is the level of the immunity cells by testing what are called CD4, cell counts. These are the various things that we test. Apart from this, we also must know that there's something called a window period. Let us say the person is infected with HIV. They may not have produced the antibodies because largely the ELISA test is testing for antibodies. They may not produce the antibodies at a measurable level in the body for about 3 months. So once infected with HIV, there is a window period for ELISA testing up till which it can remain negative even though the person is infected with HIV. So that is a very important one to understand. Therefore, we have some newer tests where we test for the viral DNA itself, where we test for what is called the early antigen, which is or the P24 early antigen, which is the uh, part of the envelope of the virus, which is also tested for. So there we are looking for the antigen. You may understand this a little better from the knowledge of the coronavirus antigen versus antibody. So the antigen is part of the virus particle itself. Antibody is the reaction produced by the substance produced by the immune cells of our body as a reaction to that particular antigen. So in the early phases, you will be able to find the antigen levels, and after 3 months have passed, the antibody levels can be picked up. So this window period is important to recognize that people may still be having the infection and test negative in that window period. Now, in the last 15 to 20 years, we have very good, effective medications for HIV that we recommend treating every single person that has the HIV infection without having to really check the CD4 levels. However, we do want to monitor the CD4 levels also for efficacy of therapy to ensure that the immune cells are going up in number after having started therapy. So we now recommend treatment for everybody. So treatment is universal. And secondarily, we have very, very good medications and about 5 to 6 different classes of medications, out of which the practitioner may choose to use 3, 4, or sometimes 2 drugs to be able to control the HIV infection. The goal of treatment is to control the HIV infection where the virus is at an undetectable level for life. If that is achieved, and usually it is not that difficult to achieve as long as the treatment compliance is ensured, if that is achieved, the longevity of the person is near normal. Number one is creating awareness among one and all regarding how the infection spreads. I mean, there are several people who still have a lot of ignorance around it. Wonder if whether does it spread by saliva, does it spread by using the same towel, does it spread by touching each other, handshakes. All of these modes of contact do not spread the infection. So important first step of prevention is to create an awareness as to exactly how it spreads. So we did discuss the major modes of transmission. Number one is sexual. Number two is injection sharing among IV drug abusers. and number three is from the mother to the child. So there are various prevention strategies for each of them. Use of barrier protection devices for sexual exposure, injection sharing by using only disposable syringes. Various programs are able to distribute these syringes, even though we feel like okay that might be propagating IV drug abuse, but it might actually curb the HIV infection spread. So there are various strategies, both publicly as well as in a private way, that people utilize to be able to prevent the spread of the infection. One of the major myths is how does it spread? Is it spread where by blood products only, by sexual contact only, or is it also spread by kissing and touching and using common items by just sleeping together, in a bed rather than without any sexual contact? So there are various ways, various things that people don't understand. So, like I already mentioned, sexual contact, IV injection drug abuse, blood products from the mother to the child. These are from healthcare for exposure of healthcare workers as an occupational hazard. These are the few ways in which HIV can spread. All other ways, generally, HIV does not spread. So you can live with a person with HIV comfortably, closely, and not get infected yourself. Secondly, is it possible to live a normal life after having HIV? Very much so. The medications are very effective, and person's longevity and the quality of life, honestly, as long as the compliance is maintained to the medications, it does not get much affected. You have to go for regular checkups, and you have to go for basically altering your medications if necessary, but the overall quality of life is well maintained. If you are an infected person, do you ever become uninfected? Meaning, do you ever become HIV negative? As of now, no. Once an HIV person is infected with HIV, they continue to be positive. They do not become negative. Having said that, when you're on medications for a long enough time that your viral load is undetectable, then the chances that you spread the infection even through these contacts to other persons become near zero. So it is negligible. However, we always advise you to exercise caution and use protection while being close with somebody or involving getting into a sexual encounter with anybody, even though you're on medications and the HIV levels are viral levels are undetectable. So there are some of the broad myths which people with HIV or people think of about HIV infections.